But today there can be absolutely no doubt that our country is facing a major public health crisis, the likes of which we have never experienced. Last year, Labor Day, we publicly went on record commending the government for the measures they took to contain the spread of the coronavirus. It is unfortunate that this year we are forced to express a completely different position. Last year when I stood here on June 19th, we had 123 cases and 8 deaths. But this year, as we speak, we have over 29,600 cases and over 700 of our citizens have passed away. In May alone, we had 326 deaths. There were more deaths in May than for the entire previous year. Whilst the government seems not to be alarmed and are quite comfortable just to announce the number of deaths, what they are not telling you is that our death rate of 3.5% is higher than that of most countries. They seem to have absolutely no sympathy and empathy for the grieving families of those who were struck down by this deadly disease. In addition, they recently reported that there are 455 patients in the hospital. But wait, these are only the figures coming from the Ministry of Health's report. We are informed by our comrades in the Trinidad and Tobago Registered Nurses Association, we are informed by them that the ministry's figures do not take into account patients who are already diagnosed, critically ill, and are waiting to be assigned a bed. These are the people in the tents, in the waiting rooms, in the corridors, on chairs and benches. These numbers are not accounted for when they give their updates. The TTRNA, Trinidad and Tobago Registered Nurses Association, has consistently complained about the regional health authorities and the Ministry of Health. The RHAs and by extension the Ministry of Health are currently hiring nurses and midwifery personnel as temporary employees. This trend predates the COVID-19 pandemic and has been a major contributor to nursing attrition. Due to poor hiring and poor management practices at some of the RHAs, the staffing is severely short. This short staffing has been further depleted due to the COVID-19 pandemic, with the introduction of the parallel healthcare system and with the increasing cross-infection rates within the healthcare settings. The limited amount of staff available to care for patients is having a direct impact on the quality of care. For example, 1 registered nurse to 30 patients is totally unacceptable, and there are actually instances where such ratios exist. Some nursing students are experiencing challenges to graduate as they have been prohibited from continuing their clinical practices or have been informed that exams were suspended. The cancellation of stipend has also been a critical concern for the Trinidad and Tobago Registered Nurses Association, as many nursing students depend on the stipend to purchase books, meals, and personal items for the duration of the program. And further, there are no strict adherence by the RHAs to the protocol that maintains proper infection and control practices, such as adequate and appropriate PPEs, consistent adherence to quarantine and isolation protocols when there are high-risk exposures. Nurses in many RHAs are not compensated with overtime for longer working hours, nor are they provided with special daycare arrangements for their children who are currently home due to the COVID-19 restrictions. JTUM also has serious concerns that the Registration, Recognition and Certification Board has been experiencing challenges to meet, and this has been a major obstacle to the TTRNA's application to be the recognized majority union for its membership. Although nurses are making significant contribution to the healthcare system in this COVID-19 pandemic, their union is still not being given recognition status. Today, JTUM calls for the recognition of the TTRNA as the recognized majority union at all of the RHAs.
Good day, Trinidad and Tobago. I am Ozzi Warwick, General Secretary of the Joint Trade Union Movement and Chief Educational Research Officer of the Oilfield Workers Trade Union. You have just heard another excerpt from the Labor Day feature address delivered by the President of JTUM, Comrade Ansel Roger. And whilst indeed the Labor Day feature address dealt with a whole range of issues, one of the major issues that was addressed are really the issues surrounding COVID-19 and the health system in general. Well, with me here today, we have the President of the Trinidad and Tobago Registered Nurses Association, and that is Comrade Idi Stuart. And I think a number of persons would have heard the TTRNA mentioned a few times in that feature address. That's just to tell you the level of priority that was placed in terms of the issues, the health crisis and the issues facing our nation's nurses. So good day, Comrade Idi.
Pleasant evening, comrade. Thanks for having me.
Right, you would have just heard the excerpt from Comrade Roger's feature address delivered on Labor Day. And I guess you would have heard that a substantial part of it would have been to deal with the question of the pandemic. But one of the things that really jumped out at me was the point he raised about the government not giving us the full picture. I think, can you, in your capacity as president of the Trinidad and Tobago Registered Nurses Association, really the frontline workers, can you help Trinidad and Tobago get a better picture as to what's going on?
Well, firstly, let me first acknowledge the excellent work done by Comrade Roger in his surmising some of the difficulties that we were experiencing, the association, the nursing association, nursing personnel were experiencing during this pandemic in his Labor Day speech. We really want to commend him there firstly. At the end of this, there has been calls by certain segments in the population to have some form of evaluation post this pandemic experience. And TTRNA is endorsing that call to let us review, not for the purpose of blaming anyone, but for the purpose of improving on our response for, God forbid, if this has to happen anytime in the future. It is unacceptable in TTRNA's point of view for us to be having one of the highest death rates due to COVID-19 anywhere in the world, basically. We're in the top in terms of the death rate, caseload over number of deaths. That is indisputable. That could be easily verified and checked on the WHO websites. So that is not something that we could rest easy on. What is going wrong within our response to COVID-19 that is generating such a high death rate? We are not comfortable with placing the burden solely on persons having non-communicable diseases. We want to dig deeper to see what is the real response. One of the factors definitely is the level of non-communicable diseases in Trinidad, definitely. But however, there are other extenuating circumstances. And one of those was that we were short on nursing personnel in Trinidad and Tobago. So when the pandemic hit, we were not in a position to take a cadre of experienced nursing personnel and separate them and place them in the parallel healthcare system. We had to rely almost 90% of the time on nursing personnel who had no prior experience, were junior nurses, were actually unemployed up until time of the COVID-19. And we have to rely on them. And we did that for nursing staff, we did that for medical staff, we did that for a number of these disciplines. And we believe that is also contributing to the high death rate. That is just one of the multiple factors. There are other factors in terms of, besides the NCDs issue, because we are top in the world in NCDs in a number of areas: prostate cancer, diabetes, coronary artery disease. So that speaks to how our healthcare system, which we really can't call a healthcare system, we really have to call it a sickness care system, because we wait for you to become ill before we begin to interact with you in the healthcare system. So it's really a sickness care system that we have been running, and we need to move away. We need to move away from the shine of buildings, building new buildings in Point Fortin, in Couva, in Sandy Grande, in Roxborough, in Rarima, thinking that that is healthcare. That is not healthcare. That is one aspect of healthcare. That is secondary healthcare. What we really need to focus is on primary healthcare and get everyone monitored and constantly evaluated to keep themselves healthy. So that's one of the major reasons. There are multiple other reasons, but a proper assessment would really need to be had to really garner from all disciplines, from the medical association, nursing association, all the other disciplines within health. Let us sit down and let's really evaluate how we responded. If we gave Trinidad and Tobago the best value for money that we could have found. In our point of view, while there were indeed positive aspects with the government response, there were some areas which we believe could have been improved. And some of those areas would not have cost any significant financial injection, but it's just how you would have responded we were really hoping. And unfortunately, being one of the largest groups within the healthcare system, one would have thought the regional health authorities and the Ministry of Health would have included the Nurses Association and included a number of other disciplines, professions related to medicine, the Medical Association, a number of these persons in be part of your response team so they could have an input into how the response would have gone. And unfortunately, sadly, in what we call a democracy in Trinidad and Tobago, that was not so. The few opportunities we had to contribute was because of our lobbying and our demanding to get into that discussion table to get our voices heard. It was never an environment where they sought out our input, which is extremely strange, extremely ironic, and it did not mirror what we were seeing from our other colleagues of the islands and our other colleagues internationally. They were specifically sought out to gain their buy-in, to gain their membership buy-in, to get them to appreciate what the government is doing, to get the government to appreciate what are some of the association's concerns. This is what we were experiencing from our colleagues internationally. Sadly, our style of democracy seems not to lend that well in our scenario. And we would want to dismiss that. We would really want to change that. And we would really want to utilize the resources of our country for the benefit of our citizens, definitely. Where we also fall short in terms of our COVID response is that we have very few specialist nurses. While we had, thankfully, we had those junior nurses at home waiting employment. And as the COVID-19 hits, majority of them, if not all, have since been employed. So we had a group of general trained nurses at home waiting, where we definitely fall short that we didn't have specialist nursing personnel for the intensive care unit, ICU, for the high dependency unit, HU, for the dialysis, those persons who would have needed dialysis. And a number of those pediatric nurses, we didn't have the specialist nurses because we have not been training at a rate even for our general system. So when COVID hit, that just exemplified the problem and really highlighted. So those persons who are currently working in the intensive care units, who were placed first day on the job, you are being placed in an intensive care unit. Absolute craziness. You will not find that anywhere else in the world. You would find persons who are working in ICU, those persons would have been in the profession at least 5 years, and then they would have demonstrated themselves to be able to go to another training program for another 2 to 3 years, 18 months, depending on which course it is, for you to get that additional training. We took nurses fresh out of school and placed them in this environment. So that was a rude awakening for those junior nurses, and we really want to commend them for giving their all, for giving their utmost, or giving their all to really save lives. One second. Yes. So we really fell down. And when one looks at right within the Caribbean, this is why we really need stakeholder input into when government makes certain policies. Even with the training of nursing personnel, if we watch right within the Caribbean, Cuba, which has always been a very marvelous example, how they train their nursing personnel. They don't train them single train. They don't train them exclusively for psychiatry, exclusively for general nursing. When a Cuban nurse or even a Filipino nurse, because those are the two groups who government, Trinidad and Tobago government actually brings to Trinidad to work in our healthcare system, in our public healthcare system. So if you are acknowledging their worth, the Cubans and the Filipinos, if you're acknowledging their worth, why not train? Why not remodel your nursing education to match what you are bringing in? In those territories, they train all of their nurses in 2 disciplines. So you will be both a general trained nurse, and then you will be trained in pediatric or ICU or HDU or midwifery or whatever it is. So Cuba, who had a higher caseload of COVID-19 than Trinidad and Tobago, because they left their borders open for various reasons, humanitarian, they allowed cruise ships to, when all other countries blocked cruise ships from coming to their shores at the onset of COVID-19, when it have all those cruise ships were still out, Cuba allowed them to come in still, because they saw it as a humanitarian crisis to leave persons out on the open ocean. So they allowed persons. So they had a larger caseload than most Caribbean countries. Yet, even to this day, even though they have a larger caseload, they have a lower death rate than Trinidad and Tobago. And that is really remarkable. That is really speaks to their health system, their robust primary healthcare system, their involvement at all different levels. So there are areas where we could learn and did not cost them a fraction of what it cost us in Trinidad and Tobago to run. We spend, it's not that we are not spending money on our healthcare system. We're spending, healthcare is often in the top 3, is always in the top 3, first, second, or third. It's never out of that top 3. So we are spending billions of dollars. Are we reaping the rewards for this? It is to be determined. And if we look at all the commissions of inquiry that we had into the healthcare system, the Gladys Before report, the recently concluded Monroe, I forgot the name, and when the TNM government came into office in 2015, they conducted another commission of inquiry. Can't remember the doctor name, but that report came out in 2016, 2017, somewhere around there. And it also spoke to some of the same problems we have been having ad nauseum, and the same recommendations came up once again. And it's the same recommendations that have not been acceded to by the government and adopted by the government, sadly.
That seemed to be the government style. They get all these recommendations from all these committees and they just don't take any of their advice. Comrade Roger mentioned that, and it's really true. Comrade Stuart, you've really given us quite a comprehensive response. So I don't know if there's anything else you'd like to add as we close off.
No, I think that's the first in this segment. Yeah, that's definitely the
right
where I will want to leave.
He did also raise some very specific issues to TTRNA. I do not know if you want to just quickly touch on those.
So some of the areas we have, and thankfully Comrade Rouge mentioned it in his Labor Day address, is the continuing unacceptable practice of the government, the regional health authorities, with the apparent blessing of the Ministry of Health and the Cabinet of Trinidad and Tobago, to continue to employ nursing personnel on temporary employment. That is unacceptable for TTRNA. It makes no sense to us that there is no justification, there's no rationale where you would spend billions of dollars on all of these secondary healthcare facilities, all these hospitals throughout Trinidad and Tobago that the government has built, both governments, and then you see the need to have these permanent structures because you see the need for healthcare increasing on a daily and weekly and a yearly basis, yet you do not see the need to have permanent staff to run these permanent structures. We can't see the logic. We would have brought up this issue in numerous forums, including at when the Prime Minister, the Honorable Prime Minister, was having his town meetings. And he had a session at the Excerpt Spaniard sometime in 2018, somewhere around there. I can't remember the exact period. And we brought up, I personally asked the Prime Minister this question at those town meetings, asking him, why is the government not making nursing personnel permanent anymore? And they are making them, giving them these very short-term contracts, 3 months, 6 months, 1 year. The max they will get is 2 years. And some of these contracts are not even genuine contracts because they are basically breaking their service before they reach a year to try to avoid paying them any gratuity, to trying to prevent them from getting any benefits. This is the government of Trinidad and Tobago doing these things. This is not a private organization trying to, that we know some private organizations tend to do. This is the government of Trinidad and Tobago. So when I asked him that question, he responded, he was saying he was not aware that the regional health authorities are not making persons permanent. And that really, he was not aware. He says nursing categories is permanent employment. They are not supposed to be on contract and on these short-term contracts. We had a meeting with the Minister of Labor, the then Minister of Labor, Jennifer Baptiste Primus. We had a meeting with her and she said the same thing. Some of these practices they are doing, this, because she came from the public service as being a former president. And she's saying some of these practices, they were hiring nurses as daily paid nurses and had them on that arrangement for months. Actually have nurses working. When they come to work, you get paid for that day. We always remark some of our colleagues, like the CPEP workers, had more job stability than nursing personnel. And that was such an eye-opener for us that the government of Trinidad and Tobago, the regional health authorities, and in specific authorities like the TRHA, they actually took a policy decision and they would tell you that they stop making nursing personnel permanent. They're actually saying that you had the NCRHA doing the same thing. They're no longer making nursing personnel permanent. They took a decision sometime 5 years ago to no longer make nursing personnel permanent. And the sad thing is, nursing personnel, well, almost the benefit of it is that nursing personnel do not have to remain in Trinidad and Tobago. They are being offered opportunities in America, in England, in Canada. So it's not that the nursing personnel have to stay in Trinidad anymore. There has always been this exodus, but there has been a recent report demonstrating that the world is short by how much millions of nursing personnel. So these recruiters are coming in their numbers to recruit our nursing personnel. So what we have happening is that as fast as we train nursing personnel now, because we are not appreciating them with the basics, they are now leaving constantly. So we are constantly having to have these junior nurses manning wards. When I passed out, I always remark, when I passed out as a nurse, some 12, probably more years ago, 15 years ago actually, the head nurses on the ward were senior persons. They would have been in the working in the healthcare setting in excess of 20, 25, 30 years. Now when I enter some of these units, I'm seeing the head nurses who are the senior ones. They are 3-4 years because all of our senior ones are leaving. They would have gotten the experience. They would have been fed up with these short-term employment arrangements and some real unethical industrial relation practices. And they say, look, it's best I go abroad. Not because they want to, because you're leaving your family, your friends to go and work in a foreign land. You know, the climate is extremely harsh. Sometimes during the winter periods, they prefer to go up there to work than remain within Trinidad and Tobago borders. It's really sad. We have continued to build these first world countries through educating our professionals and exporting them. I mean, if that is the purpose of having nursing personnel on these short-term contracts, because you actually want the migration of nursing personnel, well, then the government is doing a good job. But let us know that is your plan. You know you want to export your best and brightest, and you no longer see the benefit of having your best and brightest remain within your shores to care for your citizens. We will know. But I always remark too, when I was a student and as a junior nurse, and you witness, and Comrade Roger spoke about it, I have actually witnessed firsthand how nursing personnel, nursing and military personnel, the quality of life and quality of their work has actually depreciated over that time. We used to have nursing hostels in Port of Spain General Hospital. That is no more. They have demolished it and made it a car park. We used to have nursing hostel in San Fernando. That has been left abandoned. We used to have nursing hostel in ERHA. That is no more. They are using it as office space. So a nurses hostel was critical to allow, firstly, nursing students to have a place because nursing education is centralized and you need to really be in the hospital to gain your practical experience. And seeing that you actually will be working on the wards, you'll be both in classroom at the various nursing schools and then also have to work on the wards. It's easier to have the students actually live on the hospital itself so they could gain their experience because they're not being paid. Like how you will have police and army and police, when they're in training, they actually get something close to a salary. In nursing, you don't get a salary, you get a stipend. And even that stipend they took away recently. So they have taken away the stipend that used to assist you a very small, $1,000 to $1,200. They took away that from students. So students have to find their own money to transport to and from health centers and hospitals to actually go and work on the wards. They took away the nursing hostel. Before COVID pandemic, they actually took away the normal transition from the minute you used to pass out as a nursing student. You walked into a job at one of the RHAs. They had stopped hiring nursing personnel. So if there was any one bright spot coming from this pandemic is that those over 100 to 200 nursing personnel who were at home waiting employment for some 3+ years, they were absorbed and they got employment. So if there's one thing that came out of this pandemic is that those 300+ nursing personnel, 200+ nursing personnel actually got employment in some of these parallel healthcare systems. Some simple things we have been asking the ministry, and we are watching all these new facilities going up. Nursing is predominantly female, probably 98% female. We know females, one of their major issues would be how they take care of their children. What daycare facilities, most modern hospitals, I wouldn't even say modern, it's almost common practice now, not only as hospitals, but in some other industries, you would see daycares being built into your facility. You would have that set aside because nursing personnel work or 24 hours a day. So if you are required to work 24 hours a day, whether it's morning, evening, or night shift, you are expected to work this shift. Who is going to take care of your little ones when you go to work? Which daycares are open? And I'm even speaking before pandemic. Pandemic has just made it worse. There's no daycares, no school. So who is going to take care of the children of nursing personnel? And we had always lobbied for daycares to be part of these hospitals. We are seeing Port of Spain being rebuilt. We are seeing Sandy Granny getting a hospital. We are seeing San Fernando General, Point 14 Hospital getting got their new hospital. There's no daycare facility at Point 14. Brand new hospital, no daycare facility. We saw the plans for Port of Spain General Hospital, the central block that is to be rebuilt, no daycare facility in that. Roxborough, no daycare facility. So it is not, we can no longer say we have old facilities, so we can't accommodate that now. We have over 5 to 6 new facilities in Trinidad and Tobago, yet there's no daycare facilities in any of these. I believe they had earmarked a place at the Arima Hospital. That has not come on as yet. So there are so many issues. I think one of the major issues where we could resolve some of these things is allowing TTRNA to become the recognized majority union. Unfortunately, the very government who we have to go and negotiate with and lobby for, with the RHAs and the CPO, is the very government who is denying us the access to this RMU status because of what is going on in the RCB. In excess of 6 years, we are waiting on majority union status to be given to us by the RCB, despite we having 50% of the nursing numbers in excess. Despite within the act, it says this must be done in a timely manner. 6 years later, we are still in the same position.
Okay. Well, Comrade Idi Stuart, thank you very much for giving such a comprehensive sort of overview of the issues facing our nurses, issues also facing the healthcare system, and, well, as you call it, the sick care system, and the issues as it relates to the government's response to COVID. So let me just take this opportunity on behalf of the entire labor movement to salute our nation's nurses. They are indeed at the front line, and they're at it night and day in this pandemic, trying to at least provide some level of care with the limited resources that they have, to at least ensure that persons can come out of this feeling a little bit better and at least being a little bit healthier. So I really want to use the opportunity to salute our nation's nurses for the incredible job that they're doing. Comrade Roger mentioned it in his Labor Day speech, in terms of the healthcare professionals and so on. So thank you, Comrade Idi, and your membership for keeping us safe in terms of our health.
Thank you so much, Comrade.
That was Comrade Idi Stuart, President of the Trinidad and Tobago Registered Nurses Association, giving a very comprehensive response to the feature address delivered by Comrade Roger on Labor Day. Have a good day, everyone. Thanks a lot.